Have you ever wondered why we get tooth decay? Is it caused by a real mite or not? Let's take a moment to debunk a common myth and shed some light on the reality of tooth decay. Tooth decay, also known as dental caries, is not the work of a mite. Despite what some may believe, these little critters are not responsible for the cavities in our teeth. Instead, the culprit of tooth decay is much smaller and more prevalent: bacteria. Our mouths are home to a multitude of microorganisms, many of which are harmless. However, some, when allowed to thrive, can lead to oral health problems. Among these problematic bacteria are Streptococcus mutans and lactobacilli. These bacteria feed on the sugars we consume, producing an acid byproduct which can slowly erode the hard tissues of our teeth. This process is known as demineralization. The destruction of the hard tissues of the teeth doesn't happen overnight. It's a gradual process that can be influenced by many factors, including diet, oral hygiene, and even genetics. The first sign of tooth decay often starts with a white spot on the tooth enamel, indicating an area of demineralization. As the decay progresses, the enamel is worn away, creating a cavity. If left untreated, the decay can continue to the inner layers of the tooth, causing pain and potential tooth loss. It's not a pretty picture, is it? But here's the good news. Tooth decay is preventable. With good oral hygiene habits and regular dental checkups, we can keep those harmful bacteria in check and maintain a healthy smile. So, now that we know it's not mites causing our tooth decay, let's delve deeper into the science behind it. After all, knowledge is power, and the more we understand about tooth decay, the better equipped we are to prevent it. Tooth decay occurs when foods containing carbohydrates like bread, cereals, milk, soda, fruits, cakes, or candy are left on the teeth. Let's dive into the science behind this. Picture this. You've just enjoyed a delicious meal or snack. The tiny particles of food left behind are a feast for the bacteria that naturally live in our mouths. These bacteria are particularly fond of carbohydrates, which are found in many of our daily food items. When the bacteria get to work on these leftover foods, a chemical reaction occurs. Through a process known as fermentation, the bacteria convert the carbohydrates into acids. Now, these aren't the kind of acids you'd find in a science lab, but they're potent enough to cause damage to our teeth. These acids don't work alone though. They team up with the food debris and our saliva to form a sticky, colorless substance we know as plaque. Plaque has a knack for clinging onto our teeth, especially in those hard-to-reach areas that our toothbrushes sometimes miss. Here's where the trouble starts. The acids within the plaque start to dissolve the outermost layer of our teeth, the enamel. Enamel is the hardest substance in the human body, even harder than bone, but it's not invincible. Over time, these acids can wear down the enamel, creating tiny holes in the surface. These holes are the first stage of what we call cavities. If left untreated, the decay can progress further into the tooth, reaching the inner layers and causing more serious damage. You might imagine this process to be something that happens overnight, but it's not that straightforward. Tooth decay is a slow process. It can take months or even years for a cavity to form. The damage occurs little by little, almost imperceptibly, until one day you find yourself with a toothache or a visible hole in your tooth. Now you may think it's a quick process, but tooth decay actually happens over time. Tooth decay isn't a one-and-done deal. It happens in stages and can even be reversed in the early stages. Let's imagine your mouth as a bustling city with your teeth as the skyscrapers. Just as cities have waste, so does your mouth, in the form of plaque, a sticky film of bacteria and food particles. This is the first stage of tooth decay. When you consume sugary or starchy foods and don't clean your teeth properly, these bacteria feast on them, producing acids that attack your teeth's enamel, the hard outer layer. This is why brushing and flossing regularly is crucial to sweep away the plaque and keep your dental city clean. Now, if the plaque isn't removed and continues to build up, the acid starts to wear down the enamel in a process called demineralization. Tiny holes or weak spots form in the enamel, marking the onset of the second stage, enamel decay. However, it's not too late to halt the process. Your saliva has the incredible ability to repair these early signs of decay by depositing minerals like calcium and phosphate back onto the enamel, a process called remineralization. But if the decay isn't caught and halted at this stage, the bacteria and acid continue their destructive path, penetrating beyond the enamel to the dentin, the next layer of the tooth. This is the third stage dentin decay. Dentin isn't as hard and resistant as enamel. It also contains tiny tubes that lead directly to the tooth's nerve, which is why you might start experiencing sensitivity or pain at this stage. The fourth stage involves the decay reaching the tooth's innermost layer, the pulp, which houses the nerves and blood vessels. When decay reaches the pulp, it causes inflammation and pressure inside the tooth, leading to severe toothache and sensitivity. This is pulp decay, and it's a clear sign that you need to see a dentist immediately. If left untreated, the decay continues to spread and may lead to the final stage abscess formation. An abscess is a pus-filled swelling caused by a bacterial infection. It can form at the root tip in the jawbone and can cause severe pain, swelling, and even fever. This condition is a dental emergency and requires immediate treatment to prevent the infection from spreading. However, let's not forget that tooth decay is not inevitable. It's a process that occurs over time, and you have the power to intervene at any stage. Regular dental checkups can catch decay in its early stages, and maintaining a good oral hygiene routine can prevent it altogether. So remember, your mouth isn't just a city, it's your city. Take care of it, keep it clean, and it will serve you well for years to come. Understanding these stages can help you prevent and even reverse tooth decay. So, how can you prevent tooth decay and keep your pearly whites healthy? Well, the good news is, there are many ways to keep tooth decay at bay and maintain a healthy smile. Let's start with the basics. Brushing your teeth twice a day with fluoride toothpaste is a must. This simple act can make a world of difference in maintaining your oral health. You may wonder, why fluoride toothpaste? Fluoride plays a crucial role in preventing tooth decay. It makes your teeth more resistant to the acid attacks from plaque bacteria and sugars in your mouth. It's like giving your teeth an extra layer of armor against decay. Next on the list is flossing. Many people underestimate the power of flossing, but it's as important as brushing. Flossing daily helps remove food particles and plaque from between your teeth and under the gum line, areas that your toothbrush can't reach. Now, let's talk about diet. Eating a balanced diet is not only good for your overall health, but it's also essential for your oral health. Foods high in sugars and carbohydrates feed the bacteria that produce the acids that cause tooth decay. So try to limit your intake of sugary snacks and beverages. Instead, opt for healthier choices like fruits, vegetables, and whole grains. Last but not least, regular visits to the dentist are vital. Your dentist can spot early signs of tooth decay and provide treatments to stop it from progressing. Plus, professional cleanings can get rid of plaque and tartar that regular brushing and flossing might miss. In summary, preventing tooth decay involves a combination of good oral hygiene habits, a balanced diet, and regular dental checkups. It's not rocket science, but it does require consistency. So, make it a habit to brush and floss daily, watch what you eat, and don't forget to schedule your dental appointments. Your teeth will thank you for it. Remember, prevention is always better than cure. So, to recap, tooth decay is caused by plaque, not mites, and it happens in stages over time. Contrary to some myths, there's no microscopic mite munching away at your enamel. Instead, it's the buildup of plaque, a sticky film of bacteria, that's the real culprit. This bacteria feasts on the sugars in your food and drink, producing acids that wear away your tooth enamel, leading to cavities. We also explored the stages of tooth decay. It starts with the initial lesion, progressing to a white spot, and eventually forming a cavity if left untreated. Each stage comes with its own set of symptoms, making early detection and treatment crucial. Finally, we discussed prevention. Brushing twice a day, flossing daily, and making regular visits to the dentist can help keep your teeth healthy and prevent decay. With good oral hygiene and regular dental checkups, you can keep tooth decay at bay. So keep smiling and take care of those teeth.